Hello and very warm welcome everyone to this conversation series where during the lockdown I have brought to you a varied set of speaker every other month. The idea? To create awareness. My name is Rabindra Jhunjhunwala and I'm located in Mumbai. Today's conversation, we have once again Dr. Ramanan Laxminarayan. He is the founder and director of the Center for Disease Dynamics, Economics and Policy in Washington and New Delhi, and a senior research scholar at Princeton University. For those of you who had joined 9 months back may remember him in the same conversation and sharing with us how the virus was working at that point of time, and he's back. With so much of information on the coronavirus all around, it may be very hard for us to sift out the unnecessary from the relevant. And that is when Dr. Laxminarayan will bring his knowledge and inputs. So let's try and gain some clarity on the current situation and the recent learnings that we have. Before we dive in, I'm going to just quickly initiate a poll. There are going to be 2 polls, and that is going to help both Dr. Laxminarayan and myself try and understand the age group of people and with respect to how many of you have actually taken the vaccine. So if we can initiate the first poll, Samuel, and those of you who can't see it since it's being streamed live on Facebook, there are 2 questions. One is, the first question is, what is your age? And it's either you're 45 plus or you're below 45. It'll give us a sense of the demography in the session today. So we'll leave that on, and without sort of waiting, we'll carry on. So please keep voting. It'll give us a sense and help us frame some of the questions that we have. Well, the COVID second wave is spreading like wildfire, and the symptoms are not entirely the same as the first. And we are still, from what I understand, learning new things. Till a few months back, life seemed almost back to normal. Most had assumed that the worst was over. Media was remarking how well India has done in its fight against COVID-19. All this while the Western world was entering new lockdowns. Fast forward it a few months and we have record-breaking new infections and deaths, new restrictions, infrastructure stretched beyond capacity, hotels being converted into hospitals, and a shortage of vaccine. We are in the news for the wrong reason. If I look at the stats yesterday and today, India had over 2 lakh cases in a single day yesterday. Mumbai had 9,925 new cases yesterday, and Maharashtra as of today has 58,000 new cases. So Dr. Laxminarayan, or Ramanan, if I may, what brought about this second wave? What went wrong? When do you see the worst getting over? What is different this time round? Will we see more such waves? What is the lesson learned? And in the words of my partner, Mr. Kulkarni, what is the difference between the first and the second wave from epidemiologist's perspective? So I have grouped and asked quite a few questions in the same one, but I'll come back if I see that you missed something.
Right. So first of all, let me just say that the second wave that we're in was certainly not inevitable, right? So a year ago, we had a severe lockdown, and that was because the system was unprepared. People didn't know about the disease, and it was hard to communicate how serious the situation was. And in order to do that, a lockdown at 500 cases was really the only thing that could be done. And it was imposed to allow us time to prepare. Us as individuals, the health systems, for governments, everybody was unprepared. And it really made a big difference because Thanks to that lockdown and the urgency, we have more PPEs, we have more masks, we have ventilators, we have oxygen, we have a vaccine that's in full swing, although, we should talk about that a little more. But after January, a sense of complacency set in, which is driven by some notion that the disease was really gone. And there was a lot of, chest thumping about how we've done a great job and so forth. And today we see this is not the case. And in fact, in January, and I quote, this is an interview with the Financial Times, and they asked the question about what do you think will happen after this, and why are cases so low? And I basically said, listen, further moves towards normalcy, such as reopening schools and workplaces, could be accompanied by another uptick in cases as individuals without immunity are exposed to the virus. A lot of this is in the rearview mirror, but that doesn't mean we're done and dusted yet. We have an artificial situation in which we've reached an equilibrium, but if we went back to normal, then there's a lot of room for cases going up. So end of quote, and that is exactly what has happened. So what is happening right now is not surprising at all. It is simply it's poor science, poor judgment, hubris, and all of these coming together. And I wouldn't just only blame government. I would say it's everybody. It's society as a whole. I think we've been poorly served by the narrative around this. And to make predictions about this doesn't require a deep degree of scientific knowledge, right? In the sense that there is something very fundamentally simple about this. You have an entire population. It's a virus that none of us have ever experienced. So some people are infected. It doesn't take rocket science to say, well, the others, what about the others? Why did they get infected? It's only a matter of time. And once you sweep away this idea that Indians are somehow exceptional, that we have great immunity, great genes, great exposure to bugs, all that stuff is irrelevant. It's actually nonsense because this is a new virus that none of us has experienced before, right? It is not as if we've seen this before. So once you start with that starting point, you can pretty much, each of you individually, see where the situation is going, which is until everyone is either exposed to the disease or vaccinated, or a substantial number is at least, till we get to this notion of what we call population immunity, we're basically in this game for the long haul. Now, but I'll stop there because I'm sure we can play around with some of these themes, but this is the base story, and this base story has not changed since last March. If any of you wants to go back to an op-ed that I wrote in the New York Times at the end of March, and I looked at it recently and I said, that story just did not change. We are particularly vulnerable because we have a population that has high degrees of hypertension and diabetes. And in fact, when we look back at this COVID, 20 years from now, we'll realize that this was actually a disease of non-communicable diseases. It was a disease that affected you if you were hypertensive or diabetic, or had chronic obstructive pulmonary disease, or were obese. If you didn't, then you were largely spared the worst effects of this virus. And in that sense, yes, it's a virus, but it is selectively gone after a particular population having these particular conditions, and also obviously the older age groups. And the last thing I'll say is that once we have adjusted for age, and once we have adjusted for comorbidities, and we have more data than anyone does in the world, there is no difference between people in India than people in any part of the planet. And the places that appear to be better, whether it's Pakistan or Nepal or Bangladesh, are simply undercounting stuff. It is not like that they are much better than where we are either. It is simply, if you do the math correctly and you do the epidemiology correctly, every place in the planet is exactly the same with respect to individual susceptibility and case fatality rates.
You mentioned about the older group, and you want to tell us a little bit about what you classify as older group, and I'll quickly give you the result of the poll. There are 48% here who are above the age of 45 at the time of close of the poll. Right. So 48% over 45, and the rest, of course, below 45. So very high number of people above 45. I don't know what we call old.
Well, I'm above 45, so, and yeah, I guess I'm in the old category. So let's put it this way. In the above, I can show you pictures, but I don't want to, scare you guys with what I might miscommunicate or you might misinterpret. In the above 75 age group, Indians are actually at median risk for COVID case fatality compared to the rest of the world. When I say rest of the world, I'm counting basically China, Italy, Brazil, and the US, because this is the places we have very good data on. Why is that? Because if you are in that 75, 80 plus category in India, you are already, kind of unusually healthy to have made it that far. So, there's a selection bias. If you're not healthy, you would not have made it to this age at all. And in that sense, you're actually not a representative population as far as India is concerned, because the Indian ecosystem doesn't really tolerate the weak amongst us. To make it to that age group, you really have to be strong. So actually, in that age category, yes, it's a much higher risk of case fatality, but you are at better odds than many people around the world, particularly in Brazil and even in China, as a matter of fact. I think Chinese people in that age group had a higher case fatality rate than Indians did. The 45 to 70, 75 age group is the challenging age group, where if you are hypertensive, diabetic, or have, or obese or have chronic obstructive pulmonary disease, then you are at substantially higher risk than if you did not have any of these. If you had managed hypertension, if you had diabetes that was under management, and if you had, your weight under control, you are at substantially lower risk. And this is the story of this whole epidemic. It's amongst people who progress to to the stage of severe disease, 80% had one of these comorbidities, right? So which means if you didn't have the comorbidities, it's a very, very low risk. And even the remaining 20%, it's really not that great. So in that sense, it's really a disease of our habits, of our lifestyle, of our behavior, of our, physical fitness and all of these things. And so again, don't take away what I'm saying and get scared by it. I'm just trying to lay out the facts as far as the science goes. It does not mean that you individually are going to, suffer from COVID or have something terrible happen to you, because you have to remember that at the end of the day, the overall risk of dying from COVID is actually still quite small, right? It's still quite small. My guess it's about 0.2%. So what is 0.2%? It's 2 per 1,000. Now, why are we so scared of it? It is because for most other diseases, you don't have almost everyone being infected by it. Flu doesn't infect everybody. Typhoid doesn't infect everybody. So when the disease doesn't infect everybody, that 2 per 1,000 is not a, deeply meaningful. It's concerning for us only because this is a disease, because of our lack of immunity to it, because of lack of prior exposure. Nearly all of us are going to get the disease or be vaccinated, before we get that disease. It is for that reason that it is troublesome. It is not because your risk of this from this disease is particularly higher than many other things that you might get.
So I was going to ask you this question later on, but I think the way I see it, and I'd like to summarize that, whether India is an exception in terms of COVID-19 in any ways, the ones which we have identified is one, the age group above 75, and what you mentioned. Second is comorbidity are the biggest driver of the disease, and that's the reason for the mortality. And we have a dangerous age group between 45 and 75. And I should add that, in terms of in terms of our demography, 65% of Indians are under the age of 35.
Exactly.
Great. So I am going to come back to vaccine and this age group later, because there are some questions around who should get it in the Indonesia model and generally. But before that, in terms of my sequence that I have in mind, there has been this sudden rise in the number of cases, and it's more driven, at least to the date from the data that I've read, in metropolis and some tier 2 cities. Why is that so?
Simply because we're not under lockdown. If we had not had a lockdown last year at the same time, you'd have had the same trajectory. Because this reproductive number we keep talking about, in our data, and we published a big study in Science in November, which is the largest COVID epidemiology study in the world. And it was, is widely cited because it is the largest and, obviously the first from a developing country. And we had data from Andhra Pradesh and Tamil Nadu for this. the reproductive rate of the virus came down significantly after the imposition of the lockdown. Even though it was an imperfect lockdown, it still made a tremendous difference.
Sure.
What we are seeing today is a glimpse of the situation that we would have had last year if we had not had the lockdown. In fact, it would have been worse last year because we didn't even have this level of population immunity. At least today, we have some level of population immunity and we have some level of vaccination. So you can imagine how bad things would have been, a year back in that situation if there had been no lockdown. That is, you can explain everything about the difference between last year and this year with just two things, which is no lockdown and higher levels of testing, which allow us to pick up more of the cases. That is really the only difference that we need to explain what is happening today. Now, we don't need the variants or increased transmissibility or any of that stuff to explain the data in a sense. Sure, it might be causing more damage or it might be adding some more complexity, but we don't need the variants as an example to explain what is going on today. Today is just, we entered a different equilibrium, and that equilibrium means that this is the rate at which the disease goes up.
So we are, you're saying, testing more in cities like Mumbai and Delhi.
Compared to a year ago, right? I mean, remember, a year ago, our testing was probably 1/100th of what we're testing right now. So we didn't pick up very much, and we also had a severe lockdown. I mean, we really couldn't go out at all. So now we're back to normal for all intents and purposes. And in a normal situation, this is how this virus behaves.
Understood. I won't get into the detail right now of the benefit of lockdown and the restrictions that we have today and your views on that. Maybe we'll cover it later. But I had an interesting data point which a friend of mine, Anirudh Shankar, shared with me about Chhattisgarh and a small place called Bemetara, where the prevalence is almost 20,000 to 10 lakh. And when you compare that with Nagpur and Pune, it's only about 12,000 to about 10 lakh population. So question really was, why is COVID spiking so much in like a very rural area in Chhattisgarh?
Because it didn't reach there before. In the first round, it just wasn't there, and we probably didn't have the testing facilities in that place to even pick it up, right? So that's all it is. I mean, it's going to be, again, start from my starting point, which is everybody will eventually get the virus or will get the vaccine before they get the virus. From that standpoint, you already can predict this game exactly the way it's going to be played out. It's almost numerical like clockwork. There's nothing fancy about this.
So, and again, not to scare people, but considering there are 2 lakh cases, positive cases yesterday, I don't know how many were tested. In terms of your modeling, how many more do you think without the testing across India you would have on given date when 2 lakh is the identified number?
See, when we modeled this, we thought that the caseload, so there's an underlying set of infections. We only pick up some of those as cases because our testing is limited. My guess was always somewhere between 20 and 40 was the number that I was using last year. As it happened, ICMR published a study in the Lancet, which looked at serology. So it looked at how many people were exposed based on antibodies in their blood, and then looked at the actual number of cases in those areas. And they concluded that that ratio between infections and reported cases was roughly 26 to 32 is to 1, which means for every case we pick up, there's somewhere between 26 and 32 infections. This is not my study. This is ICMR study published in the Lancet. Now, today, I don't think that's very different. It's roughly in that order, maybe 25, maybe 30. So if you see, 100,000 cases, chances are that we probably have 25x that number in terms of underlying infections.
That is scary.
No, it's again, that's just the math of how it works out, right? So, I mean, again, I don't want to be unemotional about it. I understand that people are scared. And I should also say this, at the outset, because you didn't ask me this. People often go into sheer panic. A friend of mine today was like, well, my wife was in a elevator. She was wearing a mask, and the other guy was not wearing a mask, and he was tested COVID positive, and they were in the elevator just left only for 15 seconds. This was in Mumbai. That guy was a secretary of the association or something, and she couldn't sleep all night. And I had to say, listen, your risk from these kinds of encounters is vanishingly small. I know we went about it last time also in terms of the actual risks. but actually your risks are really small. It may seem that everyone around you is getting it, or there are a lot of people, suffering and dying of it. But this is not an inevitability, nor is this out of your control, nor do you need to live in, absolute fear of this virus. You just don't. And I think take common sense precautions and you'll be fine. And even if you get COVID, as long as you're not in these risk categories, and the risk categories are obviously, monitor for SpO2 and so forth. But if you're not in the risk categories, also your risk is really small. Again, remember, it's 2 in 1,000 that die of this. And those 2 in 1,000 are either very old or they happen to be in this category of comorbidities.
Sure.
So I just wanted to, reassure people that, fear is not the way to deal with this virus. I think we should go about our normal lives, but do it in a way that we're taking precautions.
Absolutely. And since you mentioned about the lift example, and there were some questions around the virus, your thoughts around this virus being airborne and what we know today, and generally about surface transmission. Maybe we can just cover both now.
Yeah. Yeah, tell me what the questions are.
A question really is that, what is the latest in terms of surface transmission? To what extent does the virus survive and transmit through surface? Because, initially there were so many protocols which had been put in place, and now it seems the studies seem to suggest that the chances are very low.
It was always very low. If you remember, that's what I said to you even last time when we spoke. These risks are extraordinarily low. And, I find it sometimes odd that we sit and have people in the middle seats of airlines, wear these PPEs imperfectly, thinking that that somehow protects it from COVID. A lot of things that we do are, frankly, just stupid in terms of they don't really make a material difference. This is a respiratory virus. If you're within, 3 or 4 feet of someone else and you're not wearing a mask, that is going to be the number 1, number 2, and number 3 ways in which you're going to get the virus. It is not going to happen I see people wearing gloves and all this stuff. And I'll tell you for the record, I have not used hand sanitizer since last February. I just don't. I mean, I wash my hands a couple of times a day, but I'm not anal about it, and I haven't had COVID, in that period of time. I just think that just don't live in fear of this virus. It's fine. It'll be okay. Just do common sense stuff. If someone invites you to a wedding, maybe say, well, no, it's not a good time. Avoid the mass gatherings, indoor dining. Outdoor is all fine. You can go for a walk in the park. I just went for a run now. All that stuff is totally fine. Just don't be in indoor spaces. And also remember that anyone is a potential transmitter to you, even if they appear to be healthy, because they could be asymptomatic. That's all you really have to do. Don't worry about the surface business and this desanitization and all this stuff. This is not really it's mostly a respiratory-borne virus.
And about kids, things have changed from the time we last spoke, from being just carriers to being infected. So maybe a minute on generally what you see, what studies show with respect to children getting infected.
Let me add one caveat first. The caveat is that the new variants, we're still figuring out what's going on, right? So we still don't know entirely everything about it. But actually, 2 days ago, I wrote an editorial in a Spanish newspaper. I didn't write it in Spanish. I wrote in English, and then they translated in El País, because they had exactly this question about, can they open preschools? The risk to children under the age of 10, either of acquiring the virus, of transmitting the virus to someone outside of the age group is extremely small. Now, it is unusual for for people to study these pathogens is because typically these small kids are lethal. They're the ones who carry a lot of bugs and bring it to the elderly and so forth. That is not happening in this case. In fact, in all the evidence that we have from the US across Latin America, where this concern is very high, reopening of preschools, daycares has not resulted in a spike in infections. The young adults who are age 15 and above or 14 and above, those folks behave much more like other young adults who are in the 20+ age group. So they're also children, I guess, from where we sit. But they are probably at higher risk both of getting it and transmitting it. But again, their risk of terrible outcomes is really low. Remember, if you're under 35, you shouldn't even be watching this, because this is not even, it's not even relevant to you beyond, taking care of your parents or grandparents or something. You're at extremely low risk of getting or suffering from the disease or anything like this. But I think that preschools, daycares, from the data that we had previously, that there is really not much of a risk there.
In hindsight, could we have done anything differently?
Well, yes, quite a few things. I think in hindsight,
your top 3, top 5.
I think the first thing is that, as you know, my training is an economist and an epidemiologist. And the reason I work in these two fields is that, and this is the class that I teach at Princeton. I've taught for, many years, actually for 12 years now, in that same course, which is that the single biggest determinant of these viral dynamics is really our human behavior. And human behavior is dictated by many things. It's dictated by how we observe prevalence of a disease and how we respond to it. If someone is constantly telling you, oh, this case fatality rate is very low, India has contained the virus, how can you get the person on the street to wear a mask? You're giving them two discordant messages, right? You're saying, on the one hand, it's not a big deal, but on the other hand, wear a mask even if you're sitting by yourself in a car. Just does not make sense. But the fact of the matter is that it is a virus that is dangerous. It is a virus that can be easily transmitted. It is a virus that we're not done with, right? And it is a virus that even if you have a vaccine, you're not fully protected against. And I think that these are the sorts of things to really remember. And where we messed up, number one, was in communicating that this was not a serious virus, just because in the interest of chest thumping to say we did such a great job, we sort of go about, we've sort of made people feel that this is okay. You can go to the Kumbh Mela, you can go to a wedding, you can go to an election rally, you can go wherever you want, and that's totally fine. I'm not saying that these are the only places. Lots of people have been having weddings and stuff. So we don't have to point to the Kumbh Mela as the only example. I think all of us have been remiss in some way or the other in our personal lives. So, I think that's really the important thing. The second, and related to that, is the fact that we have to have used much better science on this. We could have communicated the science much better. There's a lot more that we could have done in terms of, epidemiological understanding of the disease, which we messed up on. The third, I think we've really messed up on is really the vaccination, which is that India, as the largest producer of vaccines in the world, should not be in a position of not having enough vaccines for its population. And I think that, many of you read the Ken and other articles on, Business Standard, all very well, articulating very well what I can't do justice to, but I agree with them, which is, why were we not procuring vaccines? Why are we depending on a private company to solve our problems? I mean, this is a national emergency. We should have made sure that we had 1 billion vaccines available by June. And that's our collective responsibility. So I think those are the three.
I will come to the last point a little later when we discuss vaccine. But very quickly, since you mentioned the lockdown, in a way, there was a positive when we did have a lockdown. I just wanted to get a very, very quick sense, with whatever's happening in Mumbai, Delhi, a few other cities following. Do you see the progression of COVID-19 sort of changing with these restrictions and curfews?
No, not really. It's going to be much more by way of psychologically communicating to people that this is important, but it's not like, as there have been WhatsApp jokes going around, that the virus decides to go to bed at night at 10 o'clock or it goes to bed in the morning at 5 o'clock when the curfew lifts. So they are transmitting all the time. It may have a small effect, but this is not the main deal. The main way in which this virus is going to go down and we hit the peak is then with the point at which we all individually start wearing masks consistently, stay indoors as much as we can. And that's when the virus runs out of people to feed on. And that's when it comes to an end.
So very clear message to everyone is that, COVID appropriate behavior is important.
That's it.
Wearing the face mask is super important, physical distancing. And these are very, very highly effective in preventing the spread of the viruses, including the variant strains. And we would like to reinforce that again and again and again during the session. I want to move to vaccines, Ramanan, if I may, and
sure.
Samuel, if we can run the second poll. And for those of you who are watching it live, the poll may not show up, but the question really is just trying to identify which group you fall under. Have you taken the vaccine or you haven't taken the vaccine? And when it comes to having taken the vaccine, it could be even the one shot. And there are a lot of things that we are going to cover on vaccines. I know there are a number of questions which have come in. We may not be able to cover all of them, and the preference will be given to those who had registered and sent the questions in earlier. So while the poll is going on, very clearly, the biggest value of the vaccine is reducing the severity and the mortality. And the sense I have got is while it doesn't stop transmission, it keeps you safe.
Mm-hmm.
So therefore, scaling up of the manufacturing and rolling out vaccine as quickly and as widely as possible will be very helpful to reduce the curve of infection.
Mm-hmm.
So generally in terms of vaccine strategy, and I have a number of questions, so I'll probably quickly rattle off the questions. And if we haven't covered something which you think you should tell us, by all means, please do. Quickly, and you have already stated it why I want, but just for everybody's ears once again, what is the rationale that 45 plus are being vaccinated and why the focus should be them and not others?
Well, simply because if you want to save people from severe disease, that's the bunch that is at most risk. So go after them.
And of course, your view then is that the younger group, it'll be a waste to start vaccinating them right now.
I think so, because it's not a transmission blocking vaccine and they're at very low risk for disease. So why waste the vaccine? There's my impression.
Just so that you know, in terms of the poll, the results which have come out, 47% who've taken either one or two shots. So that's the demography here of people listening in, only on Zoom, not the Facebook Live because they can't vote. So 47% have taken the vaccine, and I guess that's one reason why a number of questions. The next one, just generally, and again, this whole debate on AstraZeneca and what I've read about the Johnson single dose as well, the casual relationship between the vaccine and blood clot, which is being interrogated. Now, is there some thought around that? You know, the fact that it is being suspended in some places, the interrogation is going on. How safe are we in India with Covishield, and generally does the benefit of the jab still largely outweigh the risk, the very minute risk which may be there?
Absolutely. Your risk of the disease and of suffering from it and dying of it are far greater than that of the vaccine. So please get vaccinated. The risk of blood clots does exist. And in fact, just so you know, one of my roles about 5 years ago was in helping set up the committee and the functioning of what is called AEFI, Adverse Events Following Immunization, at the Ministry of Health. And I'll tell you that the people who are on this in the national government are people who are really of high caliber. Obviously, there'll be political considerations and so forth, but I'll tell you the person who chairs that committee is exceptional. They are not people who would let a vaccine through if it was not going to be utterly safe. So you can trust that process there. And also remember that, we always said that the vaccine had to be ultra safe. These are all things that we said a year back, which is that this frequency of of adverse events or blood clots would never have been picked up for a vaccine that you're vaccinating only 3-4 million people with. The reason we're picking this up is because we're vaccinating hundreds of millions of people with it, right? So then it comes to the fore because you're vaccinating a lot of people all at once. But actually, this risk is just vanishingly small, and I don't think you should really. You're talking about 1 or 2 chances per million, and your risk from COVID is far greater. Please get vaccinated.
Very clear, loud message to all that please do get vaccinated, and this especially for the 53%. If you are eligible and above the age group of 45, please go and get yourself vaccinated.
Yes.
And we'll come to which vaccine and other things in a bit. I want to quickly ask about the variants and variants of concern. My read seems to suggest that there are close to 800 variants of concern in India. And, you have the UK, you have the South Africa, you have God knows whatever else. But question is,
the Brazilian, the double mutant.
All very fancy ones, but can we just briefly speak on the genetic testing for variants and check the correlation of the variant through the severity of the disease and where there is a higher risk of death, how it will impact our vaccine strategy, Ramanan?
Right. So the AstraZeneca vaccine, which is the one that we use the most, sorry.
I can hear you.
Okay, great. See, the AstraZeneca vaccine that we have has been shown to be effective in clinical trials against the UK variant, but not effective against the South African variant. So much so that the South Africans had ordered vaccines and then returned it saying, give us our money back. And they went with, the Johnson & Johnson vaccine. Now, that is not unusual to happen. Now, you'll also remember that it's not going to be that the vaccines will always work against the future variants. The vaccines itself will change in time with the variants because that's how viral vaccines actually work. But for now, there is no evidence that the vaccines are not protecting against variants. Second, we have no evidence that the variant double mutant, which is not really a scientist, means that it has two separate mutations that were identified, that this particular mutant is also more serious than any other, than the one we had before. I'm not saying that it is not. I'm just saying that we don't have evidence that it is more serious. Now, future research might show that it is more serious. We just don't know for right now. So right now, I think that the vaccines are perfectly fine against the predominant ones. And in fact, the B117, which is the UK one that we have evidence that the AstraZeneca vaccine protects against. So by all means, go get the Covishield because it will protect you against that variant and of course what we had even prior in India.
And with respect to this whole flip-flop policy and the government now suddenly authorizing the emergency use of vaccines produced internationally, whereas initially they had said they insisted on a bridging trial. What's your view on this sudden change? Why the sudden change?
Well, obviously, India is in crisis, so I think we all are aware of that. But let me also say that the Moderna and the Pfizer vaccine. Many of you who are watching this, if you guys can probably afford that vaccine because it will probably end up being 4,000 or 5,000 rupees, or maybe even more than that. But for the common man, this is not a relevant vaccine at all because A, it's more expensive, and second, it requires an insanely difficult cold chain to manage. So I think this will take care of people in the cities who are now upset because they didn't get a good vaccine or they didn't get a vaccine. It'll take care of them. But it's not really going to make a difference really for the masses of people in this country, none of whom can afford 4,000 or 5,000 rupees a vaccine. And I don't think that these companies plan to make these vaccines at 200 rupees or anything of that sort. That's not my impression. So that's number one. Will it make a big difference? The other two vaccines, I would seriously have concerns about. The Chinese vaccine. The Chinese vaccine is being used in some countries, but the Chinese vaccine, by their own head of CDC's admission, is at best a 50% efficacious vaccine. It doesn't even meet like a minimum benchmark. And the question would be, why would anyone want to take a 50% vaccine when we have much better vaccines in India itself? The Russian vaccine also is not one I would personally trust or take just because the data from this are not transparent and they're not public. So it is not a vaccine that I would have a great degree of faith in. So what does it come down to? Covaxin, which is an entirely Indian vaccine, which I would trust. And it is a vaccine that is available in government centers. Just for openness, that's a vaccine I took. I took the Covaxin, it's a 100% made in India vaccine, 100% developed in India vaccine. But that's what the Prime Minister took. It is a good vaccine. It's an inactivated virus vaccine, and it's from a company that really knows how to make vaccines. So they will be ramping up production soon. And that hopefully would take care of more. And the AstraZeneca, the Serum Institute vaccine is also a good vaccine. So I think between these and the imported ones, we'll get somewhere.
Lovely. I don't know, maybe you read my mind because my next question was actually going to be, in all this, which one have you taken? So thanks for volunteering that information. Maybe just a brief one, since there are a lot of questions on mutants and this whole fear of unknown. And generally, you have spoken about the vaccine and its efficacy in protecting vis-a-vis the new mutant. The one article which I read, and it has been troubling me, is how this virus is now acting as a stealth, and even the gold standard of RT-PCR test, the virus is being able to defeat it. So unless you have actually done used a diagnostic method and used a bronchoscope to actually go through the nasal passage or through the mouth into the lungs, you may still be testing negative, whereas you are at a very high stage of COVID positive.
You're absolutely right, Jhun. It's an issue of concern. In fact, a friend of mine, his daughter came back negative, although he is positive, and I had him redo that test. We're still learning about these variants, and the honest answer is we don't know enough yet. So, stay tuned. The science will catch up with it, but right now we just don't know.
So I guess we'll just have to invite you every 3 months for an update.
No, I think we'll know more, and hopefully be in the public domain soon.
Okay. A question, since many people have only taken the first dose, not taken the second, for a variety of reasons. I've not felt good after the first dose. I haven't had the time. I don't feel the need. I feel like Superman, Superwoman, or it's not available. A question, how critical is it to take both doses, that is administered in 2 parts?
Absolutely critical. Please, except for the last reason, there is no good reason not to get the second dose. You are denying yourself full protection. So remember that even with the 2 doses, it's only a 70% protection. But please do get the full vaccination coverage. There's no reason not to do it. Vaccine side effects are not uncommon. It is part of the game. You have to remember that as adults, we're not used to vaccination. Most of us got our last vaccine when we were 18 months old. We got our second shot of measles, and that was it, right? So we're not used to this idea of adult vaccination, but it's an idea that you should get used to, because if you're old enough, you will get a shingles vaccine, and you should get a shingles vaccine because you should ask any old people who's had shingles. It's a terribly painful disease. So this idea of adult vaccines is coming in. We have to get used to it, and vaccines will be one of the ways which protect us as we get older.
And the gap between the 2 doses, because there've been a lot of talk about it.
I think what the government has recommended is spot on, which is do the 28 days for Covaxin, do the 8 to 12 weeks, push it out as much as you can for the Covishield. And I think they've got the policy right. Nothing to quibble with there at all.
There was an interesting question, Ramanan, on getting a RT-PCR test before the second dose, and some hospitals, clinics, or those who are administering actually requiring it, because a lot of people are testing positive after the first dose, and rightly so. I mean, the vaccine, as you said, it doesn't protect you completely; it just reduces the risk. So, is there, in my household, if I were between the first and the second dose, should I be doing a RT-PCR before taking the second dose?
It is not really recommended under the policy, but if, let's say you had symptoms of COVID and then you got the RT-PCR done, then you should wait to get the vaccine. It doesn't make sense to get the vaccine when you're going through a period of infection. Just wait till you're done with the period of infection and then get the vaccine. But you need to do it only if you're symptomatic or if you feel like you have it. You don't have to do it as a routine measure to go get the RT-PCR before you get the second dose.
Okay. This one I'm going to ask again. How long do antibodies last, if anybody knows the answer? And I break it up in 3 buckets. One is post-COVID, post your first dose, and post your second dose. If anyone knows the answer.
So remember, it's not just antibodies, it's a whole set of T-cell, B-cell immunity that kicks in.
Also,
right?
maybe Ramanan, if you don't mind, sorry to interject, if you could also explain that, because every day I get 2 or 3 messages asking about this and why it is not just antibody and why you shouldn't really need to go and do antibody tests. If you don't mind explaining the 2 or 3 other parameters. And Sharad, I hope you're listening.
Right. So there are many forms of immunity, right? So the body doesn't rely on just one way in which to attack intruders. So Antibodies are typically what are the immediate protection that happens when you face a disease. Essentially, they are little, you can think of this as sort of, keys which are matched to the surface proteins on the virus itself. And then once they've learned how to do it, they know when that same guy comes around, to go after that again. But we have many other forms of immunity in our immune system. Our immune system is so extraordinarily complex that I don't think any immunologist would claim that we understand our immune system well enough. It's an extremely complex system, and sometimes it leads to trouble, right? We have autoimmune diseases. We have you have HIV, which is a human immunodeficiency virus. There's a lot of things around our immune system that we're still learning. But what we do know about viral infections is that immunity is not just in one form, it's in multiple flavors. So when people ask me, should I get an antibody test after getting a vaccination? I'd be like, no. You've got the vaccine shot. That's all you really care about. Again, I'll tell you what I did. I've not had any antibody test at all, because at the end of the day, it's not as if a higher or lower antibody count is going to determine the full spectrum of your immunity. Your immunity spectrum goes well beyond just your antibody protection. The antibodies are certainly one part of it, but they're not the full spectrum. Now, where I would use antibodies is to see if someone has been recently exposed, because typically they would have antibodies. So that's a monitoring tool. We use that as a workplace testing tool, for instance, because you can tell if there's been recent exposure, if they're IgG or IgM or whatever. But post-immunization, just don't stress. This is really, the data show that this is an effective vaccine, and by the grace of God, we managed to find vaccines that work. So just rest assured, and you'll be fine.
So maybe linked to that, if I test positive between the first and second dose, when should I be taking the second dose, and how should I be determining the timing?
I think all that you have to do is wait for that infection to wane, and once that infection has waned, then you can go back and get the second dose. Also keep in mind that exposure, even if you've had COVID in the past, I think we've addressed in a previous conversation, one episode of COVID doesn't necessarily give you the broad protection that a vaccine does. So even if you've had COVID in the past, please get the vaccine. At least that's what the science is telling us right now. Again, you have to remember, this is all evolving at light speed right now, but right now this is what we understand from many trials done. And you asked me another question, which is how long do the antibodies last? We just know that it's at least 6 months, because that's the time since the AstraZeneca trials were done. It could last longer. Maybe it's not lifelong, but it could be anywhere between 6 months to 2 years, perhaps. We don't know, but it seems to be around at least 6 months.
And that would answer some other questions which have been asked with respect to the frequency of vaccine. So practically somebody who's taken a shot or is completing a second shot in April would probably need to take another dose by the end of the year, unless science tells us otherwise.
Yes, I would say.
So I'm not sure whether it is my Wi-Fi or yours, but you do freeze up.
No, it's mine. I think I've just got a bad connection.
Okay.
Yeah. It is mine, but yeah, I think that's. Yeah.
We'll go on. But the clear takeaway, everyone, is that if you're eligible to receive the vaccine, please take it. The vaccine does provide a better, longer, and certainly a more consistent protection than just your normal immunity. Would that be all right, Ramanan?
Yes.
Last time when we
absolutely.
spoke, thank you. The last time when we spoke, we did talk of herd immunity, and we talked about the Spanish and the France and various studies. And I think we'd made some projections at that point of time about, well, 70%, if I'm not wrong, should be, we'll get to herd immunity only when 70% of the population get infected. And there were certain numbers which you'd thrown about in terms of how many deaths per day and how many positives per day. So generally wanted to get thoughts on what has evolved since the last time we spoke 9 months back, and what your thoughts are on herd immunity, whether it still is a fact or whether it's a myth.
No, herd immunity is a fact. In fact, we rely on it for vaccination. It's not a myth at all. It is a fact of science. So let me explain herd immunity so that you
please.
can understand it a little bit. See, herd immunity basically means that the virus doesn't stop only when it has infected everybody. It stops when it is difficult for it to jump from one person to the other because it has reached 70% of the population. And imagine if you're in a room of, you're in a cocktail, party. You're in a cocktail party of 100 people, okay? And it isn't like you're going to meet everyone in that cocktail party, because sometimes you run into someone you already know, you're chatting with them. So the chance that you'll meet someone you don't know, which is, you think of them as susceptible people, is going to be smaller and smaller, once you have enough people that you actually know, right? So if you know 70% of the people at that party, chances are you'll never get to meet some of the 30% that you never met. We all have that, right? We didn't meet any of the new people. Same thing for the virus. Now, I'll tell you why that is not an easy phenomenon to then extrapolate to the entire country, because remember that we don't all mix homogenously, we don't mix homogenously with everybody else. We're not mixing with people in Ranchi and Patna and Jalandhar the same way we are within South Bombay or wherever you guys live. So South Bombay or Bombay or Worli or wherever it is, that is one universe. You can achieve some level of herd immunity within that universe, perhaps even amongst the crowd that you really mix with. It's possible to have population immunity in pockets, but you need to achieve population immunity in many other pockets in Jalandhar and Ludhiana and Ranchi also for the virus to really stop transmitting. It's not as if we're one large, well-mixed population where this 100 people in the cocktail party represents the entire country, because for various reasons, whether social, economic, geographical, we would not even reach some of these people of the 100 people in that cocktail, because they're just in a different, universe. And we all live in our own universes, right? So think of it that way. That's the sense in which you should think of herd immunity. It's a very easy to understand concepts that way. That's all that herd immunity is. It is just that if there are enough people that are infected, you're not really going to reach someone who is uninfected, because you're going to run into someone, the virus is going to run out of people to jump from because it's running into people who are already immune. So herd immunity is real. Herd immunity is very much a scientific fact. Doesn't need to be proved that way. It's been proved many times, but it may not kick in the ways that you guys are anticipating, that it just stops the infection nationwide.
No, that's very useful, and I should tell you that there isn't just South Bombay people, but there are people from outside of Bombay. I can tell you that there are people from Ranchi, Calcutta, Delhi, Hyderabad, London, Italy, and Calcutta, and a few other places also who have joined in. So
no, that was a joke for my South Bombay friends, who I always tell them they never leave South Bombay, right? So.
I take no offense, since I sit in the middle. Okay, so what do you think we should be focusing on? And when I say we, I'm talking of doctors, people on the lockdown conversation today, the government, the policy makers, and what should our efforts be targeted towards? What should we rally with to reduce COVID? And just quick thoughts on what it should be short term and long term.
See, I think short term, we are lurching between complacency and fear, and neither of these is useful. This is not a virus to fear, but it's also not a virus to be complacent about. So just be commonsensical about that middle, and take commonsensical protections. Don't go to mass gatherings. Remember, your risk of transmission within the household is greatest for this disease. It's 1 in 10. In the community, it's only 1 in 40. Your chance of getting the virus actually not as great as you think it is, but it is greater than sometimes you might think, because if you actually expose yourself, then it will come at you. So that's the first thing for you as individuals. I think obviously the doctors are doing a fantastic job, on the front lines. We owe them a huge amount of gratitude for the effort that they're all putting in. It's really unimaginable what we've asked them to go through and put themselves personally at risk. I know so many doctors who got vaccinated, both the shots, but that's still not enough to protect them from the disease when they're up against so much of the virus. So I think when this is done and dusted, we'll see this as something which we really we sacrifice so many doctors, for a disease. And I think that old thing, which is before you step out, think of it as it's not just your life at stake. It's some doctor's life is also at stake, or some nurse's life also at stake. Now, I think from a national perspective, we need to solve some problems. We need to solve some problems of vaccine production. We need to incentivize vaccine production. Some people have talked about price caps being an inefficient way of producing vaccines. And I fully agree. I mean, there's no reason why we shouldn't be charging 1,000 rupees for everyone who wants to pay for the vaccine and let Serum make the money off of it,
Sure.
and provide the vaccine for free to the others. So I think we've, for me it's frustrating because there are very commonsensical routes out, and just imagine if India was not a vaccine producing country, we would be thoroughly and utterly screwed. But we are a vaccine producing country, and we have not leveraged that capability to the extent that we can. And we need to get out of this control mentality, let the free market flow, let people get the vaccines when they need to. I'm glad that Moderna and Pfizer are coming in. That helps at least take some of the pressure off, the demand that we have right now. And we should advocate for policy from the government, which is more transparent, which is more clear in where the cases from, and demand. I think they're going to be around for a very long time.
Sometime back I saw one of your interviews where you mentioned that not everybody who has COVID actually goes and infects people, but it's a very small percentage which infects a very large number of people. And my wife was very keen to get an answer what you meant by that, and maybe some data points. And
so the data that we have is that 8% of people. Yeah, the data we have is that 8% of people are responsible for most infections. Some I think 70% of infections, if I remember correctly. So it is true, and that's not just a function. It's a function of us. It's a function of who we interact with. Some people naturally are super spreaders because they happen to meet a lot of people. So for that reason, they're super spreaders. So it's a function of both behavior as well as some things to do with the viral dynamics. But it is certainly true that not everyone transmits. So, I was telling this friend whose wife was in the lift for 15 seconds, that person could have been in that, 80% category who don't transmit to anyone at all. In fact, 80% of people who have COVID don't transmit to anybody. And that person could have been one of that 80%. So again, that's the reason to not be fearful of it. Just because you were next to someone who had COVID does not mean that you will have COVID.
No, makes absolute logical sense. And again, we go back to behavior of those who have tested positive and otherwise as well. So a very, very quick comment on maybe true or false. I'm not very sure what your comment was on localized lockdown and localized restriction, this whole micro containment zone. Effective or not effective?
I think it's effective if done sensibly, but I'm a big believer that if you publicize information about cases, people will protect themselves. You don't need to lock that building down. If people know that there's someone who is infected, they will take precautions themselves. And most of the problem comes from not providing very localized information.
Understood. It's like that, so I don't remember where I saw it, but on the highway, they put up a mangled remain of a car just to remind people what you could actually.
Exactly.
Got it.
Exactly. Same thing.
Got it. So some very specific questions, if I may, Ramanan.
Sure.
CT value, what does it indicate?
So CT value is basically an indicator of whether you have COVID or not. You would get it off the CT scan. It's not something which I don't think you should really worry about that as really the primary place to go get. I know some people are concerned about it because the RT-PCR test is coming out negative, but the CT value is not really what it should be and indicates COVID infection. I would urge people not to worry about this for right now. Just don't stress about it. Your doctor will figure this out, because if you're in a state where they've taken in your CT scan, they've got you well under control.
And are you finding long haul COVID cases in India in your study?
We are not tracking long-haul COVID cases, but ICMR is instituting a study on this. There will be long-haul COVID in India, without question. Why would we be different from other people? But at the same time, we don't really. It's going to take a long time to figure out. We just don't have the information yet, and we don't have the data tracking systems. The information from the West is not super encouraging, but I'm hopeful that maybe there might be some protective effects here.
And what are the likely setbacks that you may have after getting COVID?
So they observed that 10 or 15% of people who've had COVID after 8-9 months still have fatigue, have difficulty breathing. They still have ringing in their ears. There's a whole range of symptoms that are observed more in people who have had COVID versus people who did not have COVID. Now, keep in mind that we still have a lot of studies to do here. Real COVID is a real thing, but we also have to understand that we're putting people through a significant amount of trauma, just in terms of, it's easy for me to say, listen, this is the risk, it's not a big deal. A lot of you are very concerned. It's one of my colleagues who had COVID today. I said, just relax, buddy, you're going to be fine. But, for him, it's built up to be this big moment that he tried to avoid. He sees as his personal failure that he didn't avoid it. He's worried about his parents who live with him. He's worried about his children. I get all that. I absolutely get all that. But again, don't, just relax. It's not about, I know we're all concerned about it, but that is, again, a major, this mental trauma of getting COVID and then of us putting our loved ones at risk is something that is, I'm sure, bothering a lot of you. But let's try to address that in a reasonable way, because there's only a limited amount of control we have over the situation.
And if someone has taken, say, the Covishield vaccine, both the doses, and that's 6 months or 7 or 8, however many months the antibodies and other things passes, could someone take a mRNA vaccine, say Pfizer or Moderna, or even the Sputnik, given its efficacy?
First of all, I would not take the Sputnik vaccine just yet without better trials. So we need better data on this. Now, for the mRNA vaccines, it is a question that has been posed to me privately by friends. And my answer is, I don't know if we know the answer to that. I don't see a reason why you should not after a few months, but I suspect that there will be some proper guidance that comes out from government or from some professional medical bodies relatively soon. So stay tuned for this. There are people who are thinking about this question very carefully, and there will be some guidance that's forthcoming. So just wait for that.
That has been asked by actually my father-in-law, who's a pediatrician in Calcutta. So
no, it's a very good question. In fact, I had a friend who was who's in his 70s, and he's going to the US next week. And he said, and I suggested to him, I said, why don't you look into whether you can get the mRNA vaccine? But of course, remember that, ask your doctor and figure out what the clinical advice is before you get it.
When do you think this whole thing is going to end?
It all depends on the vaccination. The vaccination is our only way out. If we can magically increase our vaccination, double our vaccination capacity, we can wrap this up in 8 months to a year. If we don't do that, we're stuck in it for a much longer period. So vaccination is really the only route out.
Fair enough. Any new data? Your findings, anything that you want to share we haven't covered, symptoms or what not to ignore, anything new, because we may not have even touched the surface.
Yeah, I mean, there is a lot of stuff, but we'll have some new studies coming out soon on determinants of mortality and things of that nature. But again, I don't want to, this is a lay audience. I don't want to put you guys in in a fear factor mode. I'll just say, please don't be complacent, but please don't fear this virus. I think that's really that's the message. Yeah.
Fair enough. Any predictions? I know we've come to Dawa, we've exceeded Dawa. I'm sorry. Very quickly, any sort of predictions? The mathematical modeling that you do, and is that different from what you just said in terms of where we are heading best case, worst case?
We're not really able to tell because it's entirely going to be a function. This peak is going to be a function of how each of us behaves. So it's going to be a function of that and the vaccination program. And if we stop the mass gatherings, if we encourage people to stay home, we don't need a lockdown. We just need to stop mass gatherings. We need to stop, people, having massive weddings and things like that. We just do commonsensical things. This will come to an end relatively soon. So that's my prediction, which is if you comply, this will come to an end very soon. This particular wave, that is. But we could have future waves. Just keep in mind, this is not over until, and begin at my starting point, which is,
of course,
most people have to be vaccinated or infected.
No, of course, loud and clear. I had a very interesting question, which I thought I'd put to you at the end. And the question really was whether the epidemic would change how we look at healthcare some years from now. And I started thinking about it, and I went back, 30 years when HIV became sort of known. It did change the profession. It introduced disposables, if I remember correctly.
Yep.
So, do you think this epidemic is going to change the way we look at healthcare? How do you see COVID impact and effect, say, 15, 20 years from now?
It's interesting you asked that. There are people in New York City who, even if COVID were to come to an end, they would still keep wearing a mask. I think masking may become part of our regular behavior for quite some time, because once people start adopting the mask, they're not going to give it up that easily. I think people may do better in terms of infection control, and which could have, broad benefits. I think the fact that it's already made a difference that India makes caps, gowns, PPEs, masks, ventilators. So it's already had a material impact on the ability of the country to make some of these things. And it's certainly beefed up the system that way. But I think that the main takeaway here is two. One is that it reinforces this idea that none of us is an individual. We are like fish swimming in an ocean of viruses and bacteria. There are far more of us than there are of us. In fact, there are more bacteria in my body. There are 10 times the number of bacteria than there are cells of me, right? 10 times more bacteria than there are cells of myself. And in that world, we need to have a much better understanding of our relationship to this world, this microbial world, not fear it, because most of them are benign. They make life possible for us. But at the same time, we have to understand that when we destroy biodiversity, or we have wild animals, or eat meat eating, all that has consequences. I hope we'll understand that a lot better. I hope, second, we'll understand the value of investing in medical research. Without that, we would not have these vaccines this fast. So remember, some postdoc has slogged it out, till midnight for many, many years with that mRNA technology for you to really have it. So remember that scientists are working, not for much pay to make that sort of stuff happen. We really should invest in science in this country. And in fact, I might come back to you with a plea, Jhun, later on, for your group to support science in India. If you think that India should support science just through the government, the Indian government spending on science, ICMR's budget, entire ICMR's budget is probably not more than $300 million. I mean, that's really chump change for a country the size of India. We need to make those investments. And if the government doesn't do it, fine. We should do it through private means, but we should pay attention. And I think the last thing we should remember here is that at the end of the day, we're all in it together. There's no you, there's no me. We're all responsible for each other's safety. And I hope that that's something which COVID has sort of brought into our mindset, that, you can be super wealthy, but you know what? If that guy next to you is not wearing a mask, you're finished.
It's a great leveler.
Yeah, it's a great leveler. Exactly.
No, I think it's a fabulous response, Ramanan, that you've given. Thank you so much. And I think we need to be definitely more responsible. And as a group, hopefully we will step up and step out and do what is needed, including support any cause that you pick up. I totally agree what the medics have done, what the frontline have done, what the scientists are doing, what you guys are doing, need to be recognized, and really, really thankful to you. On that note, I'm just going to say, and I'm sorry we have gone over the hour, the conversation has been so sort of riveting, but apologies if your question was not answered. I know that there are a number of questions which we have already covered in the last session on 20th March. So please do go back and see the recording. The recording of this one is going to be shared. Please create awareness. Please take back the bits which Dr. Laxminarayan mentioned today. Share information responsibly. If you're eligible to get the vaccine, it's important that you take it.
Please, please.
It gives you better immunity. There are measures, and those measures are masking, physical distancing. They are highly effective in preventing the spread of the virus and the variant strains. Do not panic. That's another one which I picked up. So please do follow some of these. Don't just forget this, and kindly pass this on. Kindly pass this on to your staff, to your employees, to your drivers who may not be as intelligent and knowledgeable. Kindly do that. We are still living in uncertain times. It may extend to a fair number of months, maybe the entire year. So it is important that you do it. And the more we do it, the hopefully we'll have a better chance of coming out of this mess that we are in. So I think with that, I am going to come to the end of the session. Thank you so much, Dr. Ramanan Laxminarayan, for your time, for your inputs. As always, they're brilliant. We would love to hear from you, love to get your reports. So as and when you have it, please do share with it, and we'll pass it on. Those of you who would want to stay on for the next session, whenever that is, please stay in touch. If you want the reports, please let me know. And stay safe, stay well, till we meet again.
Thanks, Jhun. Thanks for organizing.
Thank you so much.
Take care.
You take care.
My pleasure.
Bye-bye. Bye.
Bye.
See you.